personalized glaucoma management.
Dear colleagues, thank you for your patience and that you stay here and be open. So we will speak about future in which we are already stay together. And we will speak about precision ophthalmology and glaucoma management. So now, yeah, this one. Just a second. Nothing. Okay, I can start then. Nevertheless, that traditional management of glaucoma patient include other one. Nothing but type. Again. Okay, I will do it like that. So traditional glaucoma management has followed a general protocol, but now this approach is rapidly challenging, and by new model that is called precision ophthalmology. And this is a shift from reactive care to proactive, personalized management, especially critical in a disease where vision loss is often prolonged. So why personalized glaucoma management is necessary? First of all, traditional model is limited by several assumptions, like that elevated IOP is the primary driver of the disease. All patients respond similarly to medical medication or surgery, and that structural changes in the optic nerve always correspond with functional loss. In reality, glaucoma is multifactorial and highly individualized, and we not see all these assumptions works as the rules. To manage glaucoma effectively, so we have to look at our patient from all sides and then take a decision. We know that glaucoma has a strong genetic contribution, and it could be monogenic glaucoma and polygenic glaucoma, and the last one caused by the cumulative effect of hundreds or thousands of common genetic variants. So PRS aggregates these all effects, cumulative effects of these variants, and to estimate genetic risk of glaucoma. So this is not diagnostic tool, but it helps us to think about the risk of the disease. Then more than 120 genetic losses have been linked with open-angle glaucoma, and genetic markers could help predict also not only appearance of the disease, but drug response or adverse events from this treatment. And over time, treatment algorithm could incorporate genomic information to guide both screening and therapeutic choices. The next point is about miRNA that could be used and modulated, and it could be an offer targeted therapeutic approaches as well. So we know about imaging and the functional biomarkers that lamina cribrosa morphology, choroidal thickness, and microvasculature that is under study now. And but beyond structure, neurodiagnostic methods like pattern electroretinography and multifocal visual evoked potentials offer functional biomarkers that can detect the ganglion cell dysfunction before visual field loss is detectable with standard perimetry. So combine these tools. Provide a rich data-driven picture of disease and enabling more precise diagnosis, risk stratification, and monitoring. Then AI. So who doesn't speak about AI? Ultimately, AI-powered platforms will serve as a clinical decision support tools, helping ophthalmologists make faster, more precise, and more personalized interventions. And the problem is, how to analyze all data from different methods of investigation, like functional, structural, and electrophysiological. So Pharmacogenetics investigates the influence of genetic variants on the response to pharmacological treatment, and we know that the response to IO-pylori medications varies significantly among individuals influenced by genetic polymorphism of some genes. So when we're speaking about another point, digital health, new technologies are addressing this with such tools as home tonometers, smartphone-based visual field apps, and portable fundus cameras, smart medication dispensers that we already discussed a little bit. And all these tools not only promote self-management, but also generate real-time data for clinicians to review, creating a feedback loop that improves outcomes. So when we're speaking about personalizing precision medicine, it is clear that it's important, but there are some challenges to address. First, cost and access. Advanced imaging, AI tools, and genetic testing may be out of reach for undeserved populations, raising concerns about equity. Data security is very important. Genomic and biometric data must be handled with strict confidentiality to prevent misuse. Clinical integration. Physicians need training and decision support system to interpret and apply complex data effectively. And, of course, regulatory oversight. AI-based diagnostics and therapies must be validated for safety, accuracy, and bias mitigation. So despite these hurdles, the shift toward precision care is inevitable. And the key will be to build systems that are not only technologically advanced, but also inclusive, ethical, and patient-centered. So the future of glaucoma management lies not in generic protocols, but in precision-driven, patient-specific strategies that deliver the right care at the right time to the right person. Thank you for your attention.
Concepts in glaucoma management, we have almost covered everything from surgeries to lasers to sustained drug delivery devices and putting it all together in precision ophthalmology, as we heard in the last talk. I would like to have Dr. Yasmin's inputs about any of these talks. Any comments?
Medicines, because I've started using ginkgo, incorporating it in advanced glaucoma patients, and I'm seeing what I think is improvement on the 10-2. I'm not sure if this is a learning effect, but it seems that they do report improvement in vision as well. Very minor, but it's worth exploring.
I would agree with that. I've tried. She started using coins, ginkgo biloba in her patients and has started seeing improvement. I also feel the same. I've started coenzyme Q tablets from Holland and Barrett for some of our patients with advanced disease. I don't know whether the effect is psychological or not, but some of these patients, they feel that the element of difficulty in appreciating contrast when coming from a dark room to a brighter room has become much better in them. So they find it. So although there is no concrete proof to say it doesn't. Yes, so normal tension glaucoma and even advanced glaucoma patients. So they want something supportive and adjunctive. So I really don't know whether the effect is psychological or not, but a few patients are definitely started and they show some sort of a positive response. Anyone?